Injections were originally discovered or rediscovered by a woman named Janet Travell, and the story goes that Janet Travell was John F. Kennedy's personal physician. He had Addison's disease, and with his Addison's disease he had a lot of muscular pain. And what Dr. Travell noticed is she worked at the VA, and she found a lot of people had pain lying there in the beds in the VA hospital. No one ever touched them. She actually palpated and touched these patients and found that they had these really tight muscles and tight knots and bands. So she took it upon herself to take a regular hypodermic needle, regular syringe with a needle, and actually just inject a little saline into some of these people's muscles, and she found that these patients were getting better. So she developed a whole technique around it. And that's what a lot of people complain of when they have a tight, upper back or lower back. You can feel those little knots or tight bands. And what you do with the trigger point injection is you just isolate it with your fingers, and you find the knot and inject into it. It's not very deep. It's rather superficial. It's a little like getting a vaccination. It's not terribly unpleasant. And you inject a little liquid into the knot. It helps hold the knot open, keeps it from contracting back down for a little while. And these are done in series. So if you do them over series of time, you're trying to retrain that muscle so it doesn't go back into that holding pattern. And that's why it can help or be an adjunct or even a standalone treatment for back pain.